Okay, my name is Dr. Dilawar Padhani. I am consultant ophthalmologist and I am the managing director of Diamond Opticals. So we are going to discuss about the eye diseases today, and I'll start with the most common disease of the eye, that is cataract. So before starting, I'll give you a glimpse about the blindness in Africa and Tanzania, and then we are going to discuss about cataract after that. So main causes of blindness in Tanzania, of course cataract is one of the leading cause of blindness, and according to WHO estimates 1.2% of the entire population of Africa is blind, and cataract is contributing about 36% of blindness in Africa. Now what are the leading causes of blindness? Number one is uncorrected refractive errors. Now what is refractive error? Refractive error is because of the poor vision is because of the shape of the eye. Either your eyeball is long or it is short, or your cornea is not very regular. It is curved in one area and flat in another area. So that is the number one cause, and which can be corrected with glasses. The number two cause of blindness is cataract. After that we have glaucoma, diabetic retinopathy, age-related macular degeneration, and trachoma. So we are going to take one by one. So today I'll take with cataract. I'll start with cataract. Now the commonest question which we are asked, what is cataract? So a cataract occurs because of the opacity of the lens. We have usually a clear lens in our eye. With age, the lens loses its transparency and it becomes opaque, and the patient starts complaining of vision. Now what are the commonest causes of cataract? Number one is because of the age. Everybody above the age of 55 or 60 will complain of some drop in vision, and that is because of the cataract. The second is trauma. If you have a hit on the eye when you are young with a stick, or any trauma, any injury on the eye can give you cataract. Diabetes also is one of the commonest cause of giving cataract. Some medications, like if you are using steroid for a long time, like prednisolone tablets, that also can give you cataract in your eyes. And radiation, some of the patients who have cancers, they are being treated with radiation. So the exposure to radiation can cause cataract in your eyes. Now how would you know that you have cataract in your eyes? So number one is cloudy vision. Your vision will become blurred, as if you are seeing through a cloud or misty thing. Poor night vision, like when you are driving, you will have that lot of glare from the cars. Fading colors, when you are seeing at a flower or any colorful things, you will see the colors are not saturated, they are becoming fade. Your prescription of glasses will change frequently, like today you go, your numbers have something different, and after 6 months your numbers are changing. So when you see these numbers are changing frequently, then you should doubt that there is a cataract. Or sometimes you may have double vision. Also that can be because of the cataract. So how we diagnose, like when you come to us as a patient that I have got a poor vision, so how we are going to diagnose with you? So we give a thorough examination, we check everything. We have one instrument which we call it a slit lamp examination, which is a microscope. So in that we examine you under magnification with good light, and we can find out about your cataract. And usually when you visit a doctor for cataract examination, they will put some drops in your eyes and then dilate, and they also examine your retina and other structures just to make sure that you get your vision back after cataract surgery. Usually other tests what we do on a cataract patient is we check your blood pressure, we check your sugar, and also there is one test we call it IOL calculation. Like when we do cataract surgery, we remove your lens and we are going to put an artificial lens in your eye. So usually when you are going to see after the surgery, that is because of the artificial lens. So we calculate the IOL or intraocular lens which you are going to put in your eye, and that you do before surgery. So we usually ask patient whether you want to see far or you want to see near, and accordingly we calculate the lens, and then we put it when we are doing the surgery. Now once you have been operated on your eye, so what happens, like they will give you an eye patch that you have to keep it for about few hours to one day. Next day they open the eye patch and then they examine you. And usually we don't admit the patient. The patient comes in the morning and usually goes in the evening. There is no need of admission, and there is no need of giving injection nowadays. We use topical anesthesia, topical drops. So after that you can be operated. And after opening the patch on the second day or the same day, they will give you some painkillers because it may give you some pain, and some eye drops which has to be used for 1 month. Usually healing of the wound takes about 8 weeks, and they will call you in between for follow-ups and final after 8 weeks to give you the glasses if you need. Now there you see all the surgeries which take place on your eye. It is because we are opening the eye, we are using knives and everything, so there are chances of complications. So I'll just briefly discuss major complications which may occur. Inflammation, sometimes you have your eye, sometimes mild pain or redness, that can be removed with the help of drops and painkillers. The other one is infection. You may have a bacterial infection in your eye, so that also can be treated, and then your doctor will guide you how to treat it. Sometimes you will feel that your eye has become slightly smaller after the cataract surgery, but usually after few months it goes back to your normal size of the eyelid. And one of the commonest thing which usually people ask is pain. So as I told you, because of the inflammation and infection, sometimes you may feel pain, so that we usually cover with painkillers, and you use it for after cataract surgery. So with this, I think I will end my talk, and probably next session we will call you for question and answers. Thank you very much.